Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Haley Kerstetter, digital editor at thehorse.com. Planning ahead for equine emergencies can help you avoid delays in care and unexpected expenses, and reviewing your emergency protocol regularly helps protect both your horse's health and your wallet. Do you know what to do to be prepared for equine emergencies? This event is sponsored by Care Credit. To answer your questions, we are joined by two expert panelists, Dr. Michael Fugaro of Mountain Pointe Equine Veterinary Services and Dr. Stacy Cordivano of Clay Creek Equine Veterinary Services. Thank you so much for joining me.
Thank you.
Thanks for having us.
Dr. Fugaro, can you tell us a little bit about your background?
Yes, I'm the oldest one of the group here and graduated from University of Pennsylvania's vet school. I did my internship up at the University of Guelph in Ontario, Canada, and a surgery residency at Purdue University. I currently own Mountain Pointe Equine Veterinary Services, which I opened in 2010. Prior to that, I worked as a college professor for 10 years, also while running an ambulatory practice. I've had a stint at another surgical facility as well as worked for the New Jersey Department of Agriculture.
Awesome, thank you. And Dr. Cordivano, can you tell us a little bit about your background?
Sure. Hi, everybody. Originally, I am from Nevada, but I grew up in Connecticut, and I went to Penn State for undergrad and Virginia Tech for vet school, and that I was able to focus on equine medicine there, which was really exciting for me. I always knew I wanted to be an equine vet. I did my internship in New Jersey, actually up near Dr. Fugaro, and then I started my own veterinary ambulatory practice in Chester County, Pennsylvania in 2010. We are now a two-doctor practice, and I focus on chiropractic care, sports medicine, and emergency medicine. And I'm married to a mushroom farmer, which is normal here. And we have two young boys who keep me super busy. And we have a small farm with goats, horses, and a new corgi puppy.
Awesome, thank you. Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. So Dr. Fugaro, you have our first question, and it's from Jennifer in Kentucky, who wants to know what are some of the most common equine emergencies horse owners can prepare for?
So I think it's really varied depending on the industry you're in, at least occupation, but probably for most people, the most common one is going to be colic, which I'm sure we'll talk about later. It's actually not a disease, it's a symptom. It just means abdominal discomfort. It doesn't always mean that it's intestinal related. So that's one. Choke would be another. Typically eye injuries, swollen eyes to lacerations. And then obviously lacerations. Horses are always looking for something to impale themselves on. And then lameness would be probably another one. And there are various gradations of lameness from what we consider an emergency versus some that can wait till the following day or a later point in time.
Dr. Cordivano, Ryan in Ohio wants to know some of the common costs horse owners might face in the event of a medical emergency.
That's a super hard question to answer, just given the wide range of the types of emergencies that Dr. Fugaro just mentioned, and the fact that, we see huge ranging differences in types of practices throughout the whole country and what people are going to charge. But I think the kind of line items you might be faced with are certainly something like a travel visit expense or a farm call fee, some type of emergency fee, and then definitely a physical exam charge. So your kind of baseline for any veterinarian to get out to you and look at your horse, that's what it's going to include. I do think, though, you can certainly ask your specific veterinarian to give you a cost estimate of some of the more common emergencies that they see in your area. And that would be one way to prepare yourself for those costs that your horse might incur while you own them. And also, just one other thing to be cognizant of is payment at time of service. It's becoming much more common. And so being prepared in that emergency situation to either have the ability to pay at that time or give a credit card is likely going to be necessary in order for your horse to be seen.
That's a great
I would
point.
just
Thank
echo
you.
the same thing Dr. Cordovano said, is that, we have found in New Jersey that time of service is what we have to do, and that includes emergencies. And the years of, emergencies probably costing $100, $200, and, they can barter on chickens and eggs and everything else, probably is not the reality. We're in a very different type of business climate anymore, and we do have to run our practices like they are businesses. And sometimes some clients have not evolved into that. And so I think it's important to, as Dr. Cordovano said, talk with your veterinarian. We very frequently give estimates to our clients well before there's an emergency, so they kind of have an idea of what would be expected.
Awesome. Yeah, that's a really good point. Thank you. Dr. Fugaro, Lauren in Vermont asks if you can describe the different types of equine insurance available and how they can help mitigate financial risks to owners.
Yeah, equine insurance is very different than human insurance. And I think if people have never used it before, they think it's going to be like human insurance. I typically tell people equine insurance is an attempt to help you kind of defray some of the pain that you could experience from the sticker shock with it. It's not designed to pay your bills. And I typically expect clients to that they're going to be paying a percentage of it. And some practices will say, look, we expect the owner to pay upfront, and then you deal with the insurance companies on their time, whereas some other practices will deal directly with the insurance company and get payment from them. But the types of insurance, the two most common would be major medical and then mortality. And that is based on the value of the horse, and they've changed over the most recent years, and they actually keep changing each year. Right now, a horse has to be valued at a certain amount, and each policy is a little bit different on that in order to get major medical. In other words, the typical backyard horse that may just be valued at a few $1,000s, and I don't mean to make light of any value of a horse because they're all expensive. But it may not be financially reasonable from the insurance company's standpoint that the horse be valued at a higher amount. They can typically get mortality claims without major medicals. Oh, I should go back to major medical. So major medical, a lot of the policies I've found most recently are covering anywhere in the range of $500 to $7,500 in terms of total major medical. And I think that's important to know because at least here in New Jersey right now, for say a colic surgery, we're quoting anywhere from 10 to 20,000, and so 7,500 of major medical is not going to cover all your expenses with it. With most insurance policies, there will be a certain premium you have to pay, and then there's a certain copay. They typically don't cover farm fees or farm calls like Dr. Cordovano had mentioned. In other words, the actual travel charge, they don't typically cover that. And then mortality typically comes along with a major medical, but you can have mortality by itself. And then you can have other riders that are out there that just cover surgery, which would only be included what is in the OR and nothing else after that. And then you can have other riders as well. And there are a few other companies that have come into the mix within the past couple of years that have different policies. So you're best off speaking to a broker who can talk about what policies work best for you rather than going directly to the companies themselves. And they can help illuminate you on what's the best policy for your situation.
Can I just add one other option would be some of the supplement companies that do provide colic surgery coverage depending on certain specifications that they have, like your on a certain supplement of theirs and you've seen your vet for vaccines and a dental exam in the past 12 months, things like that. So that is one other, it's not proper insurance, but it is help to pay for colic surgery.
Thanks, Stacy. I did forget that one.
Yeah, that's a great tip. Thank you. Dr. Cordovano, Diane in Virginia asked what materials she should keep in her first aid kit for possible emergencies, and are there any medications that she should keep on hand?
Again, a little bit dependent on your veterinarian's comfort level and your relationship with them, whether they feel comfortable leaving medications at a barn. But certainly, I think there are some things that you can have on hand, most notably bandage material, some betadine scrub to clean wounds or saline to at least flush wounds before a veterinarian would get there. I think having a thermometer is definitely useful. That's helpful for your vet to know before they even step onto the farm. And then if you're taught how to use a stethoscope to get a heart rate, that can also be helpful. There is a document that is made by the American Association of Equine Practitioners. If you just Google "be prepared for an equine health emergency," the AAEP has a nice handy little PDF that you can download with some more ideas on there. But I think mostly something to keep a wound clean and a little bit of hints for your vet before they get there. Just some diagnostics like the thermometer are helpful.
Dr. Fugaro, Chad in Texas wants to know how owners can create a comprehensive emergency plan tailored to their location and facility.
So I guess emergency plan can vary from medical emergency to something of a disaster type of emergency. And in both circumstances, it's a little bit of role playing to figure out what it is. And most people always say, well, I have a trailer. But the truth of the matter is a trailer is sitting in the back 40. It's got a flat tire. Nobody's hooked it up in, 3 months. So first and foremost is trying to think about a situation where, let's say, you have to ship a horse into a clinic or take a horse anywhere. Let's say an area is flooded. Do you have those trailering capabilities? And we find this all the time when we go out to emergencies. People think they're all set, and we lose valuable time. Very different in human medicine, where you have, ambulances that can get places extremely quickly. Where Stacy did her internship, we could have people that are only 5 miles down the road, but somehow it took them 45 minutes to an hour to get there. And that's mostly because of logistics and making sure everything's there. So I think one of the first things is, and there are also, just like Dr. Cordovano said, the AAP and other organizations have little kind of pre-made plans that can give you some tips and tricks to think about what you might need. And I think you're going to have to tailor it to what you need. And I would also encourage you to speak to your veterinarian, and they can kind of help you with, okay, well, this is where I would recommend shipping to in those circumstances. And like I said, the same thing in New Jersey, we actually have been dealing with recently. It seems like fires have been a bigger thing, as in forest fires, not to say barn fires. And then on top of that, we've had a couple of years where we've had some flooded areas of farms, which have been surprisingly worse than what we've expected. And certainly other areas of the United States and Canada have similar problems, if not worse. You go out to areas like California where mudslides and environmental conditions are such that it's a little bit more problematic.
Dr. Cordovano, Stacia in New Jersey asks how owners should store and organize important medical records and identification information in case of emergency.
I think digital records are likely going to be best, right? They're easy to share with people. They're easier to read often than like a printed out thing or certainly handwritten notes. And, having easy access to things like vaccination records and, any medications that they may have a reaction to is really helpful for a veterinarian coming in, especially if, maybe they don't know the horse as well as their primary veterinarian or things like that. So I think having digital records handy by both the owner and, the barn manager is helpful. Certainly, stall cards with the proper identification, with their owner's information and the vet information is also very useful, especially in larger barns where there could be multiple veterinarians that service the clients. So I think those are the most important things that came to my mind.
One little add-on there, and only because I did a recent discussion with a group of EMTs, and they talked about going on scenes of accidents in vehicles, and we can think about that with trailer accidents as well. They talked about having hard copy paper, and usually on bright paper for contact information or information about the horse, should somebody become incapacitated in an accident that they can't verbalize or tell somebody what the situation is or who to call. It wasn't something I had thought about before, but it makes sense. And apparently there are legal ramifications of individuals going into somebody's pocket or purse for identification.
Yeah,
I didn't think about that on the scene of an accident.
One other, I guess, thing I didn't note would be that certainly microchipping all of your horses, especially in natural disasters, can be super helpful. I would think that most veterinarians these days have a microchip reader on their truck, and it's not necessarily going to get you immediate information, but at least if something like an accident happened, there'd be a way to track down the ownership.
Awesome. Dr. Fugaro, Sarah in England wants to know how horse owners can tell when it's time to call the vet for a suspected colic. Are there specific signs that she should look for?
Well, I think the one take home on all this is there's no reason not to call the vet, even if it's a verbal conversation, and let the vet help assess the situation on the phone. Most of us all have smartphones. We can provide either pictures or video options so we can get an idea what's going on. So I don't think you're ever going to find a veterinarian that is frustrated with you calling too much. And if they are, I'm sure they'll tell you that. But from the standpoint of symptoms of colic, the most common things are horses are acting uncomfortable. They don't want to eat. They could vary from being depressed to actually rolling and pawing. They may lay down, get up. They may look at their flank, which means both of their sides. They may do a position that's called a flamen response, which is where they kind of extend their head and neck and curl their upper lip. People often call that smiling, and they think it's cute, but it's actually a sign of discomfort in most cases, not every case. Other things that are more violent, where they're literally thrashing and rolling. Now, some horses you may find, they like to sun themselves in the field. They may be laying down, and that looks very different. Those horses look very, very comfortable, whereas other horses that are painful will actually beat up their head. They usually have very specific pressure points that they will inadvertently hit along their face, just above their eyes, on the side of just below their ears, etc. So it can vary from very, very casual, passive signs to much more violent. Oh, one more that I forgot. The most common one that I think I hear from most clients is that the horse stretches out to urinate like a male horse would do, but then they don't urinate, and they think they're obstructed, from their urinary system, like they have stones or a blocked penis. And that's often the sign of colic, and mares will also make that same posture.
Yeah, I was going to add that one. I've had a couple actually very well educated clients miss that one just because they didn't realize that stretching out like that, looking like they need to pee.
I don't think I mentioned it, but not wanting to eat. Horses should want to eat. Now, if they don't eat, just like Dr. Cordovano said, you should take their temperature, because sometimes they're not wanting to eat because of fever.
Awesome. Dr. Cordovano, Annie in Nevada asked if any organizations host trainings for horse owners and barn managers to learn how to handle emergencies. And if not, how would she go about setting this up for those in her area?
Yeah, this is going to be very specific to your area, but we have several large animal rescue trainings here. So that's like getting a horse out of a situation where they fell into a ditch or a hole or something like that. So if you Google large animal rescue training, I did look, and there are lots of different organizations throughout the country. I don't know specifically of any focusing on like emergency medical situations, but I do think if you speak to your veterinarian, most practices would be pretty happy to set up an owner education talk if they thought there was interest from their clients. So definitely, if you feel like you can get a group of clients or horse owners together, talk to your veterinarian and see if they can do it or if they can have one of our drug companies or vaccine manufacturers come do a talk about things to look out for equine emergencies for their own horses. I think that's a great idea, and most people would be super willing to do it.
Just to add on, there are some government agencies that will have some input or at least availability with it. Often the departments of agriculture will be involved. Each municipality should have what's called a CART and a SART, and those are animal response teams, depending on whether they're state or county. Typically, those type of programs, like Dr. Cordovano was mentioning, they come in cycles, and they typically come after somebody's had an incident. So people are a little bit more focused on it. Recently, here in New Jersey, we've had the fire department called on more than one occasion to a downed horse at a barn situation. So we've gotten to meet our local fire officials, including our EMTs. And so I actually have done some recent talks with EMTs and fire officials with it, and there's kind of a resurgence of interest in that. Unfortunately, you have to keep that interest going to everybody to get acclimated with each other, and it's a lot of networking that happens with these two.
Dr. Fugaro, Donna in Arizona says she worries about rattlesnakes biting her horses. What can she do to prevent this, and what should she do if they are bitten?
Well, Donna, I'd like to say come to New Jersey, because I've yet to have a rattlesnake bite in here. Not that we don't have rattlesnakes in New Jersey. I believe we do. Prevention, I'm not sure there's an easy prevention. I think being aware. Typically, what people don't think of with rattlesnake bites, usually the amount of venom that is used to paralyze small animals are not going to paralyze a horse. And horses, because they're so inquisitive, typically take this bite on the face, mostly because they are interested and they bring their nose down. They can certainly have it on their legs, on things. And I think the first thing to tell everybody is it's not the movies. You don't need to go cutting the wound where the fangs went in and suck out the venom. Don't do that. Just at this point, call your veterinarian, get the horse to the veterinarian. Some of the things that are expected to happen with it is you're going to have a localized inflammatory response, and it's usually their face and head. Things that we're going to try to do as veterinarians is put them on antibiotics. We're going to make sure they maintain an airway, because as their face swells, it could impact their airway. There are anti-venoms. I will tell you that unless you're in an area where it's very prevalent, we're going to have to find those anti-venoms, and it's not going to be readily available. And then there are, if you have an area that you are concerned about, there are some vaccines. Now, I did find out recently that the vaccines came off of their conditional license. There is a vaccine that handles basically multiple rattlesnake venoms, I guess. And I don't know the story about the conditional license, but I'm not sure who's currently manufacturing it and if it is continued to be manufactured. But that would be a way of preventing in those cases. But in the event of an actual bite, you should be reaching out to your veterinarian. There are certain things that we would wind up doing. It's mostly supportive care. These horses quite often do live from it, but it doesn't mean they're not going to deal with a fair bit of medical care and maintenance.
Dr. Cordovano, Deborah in Massachusetts asks if large animal vets are available 24/7 for emergencies. If not, how should she make a plan with her vet for after-hours emergencies?
This is a great question, and I do think the industry is changing a bit as we see a shortage of equine veterinarians, certainly in some areas of the country, not everywhere. But I think the best advice I have to you is to talk to your specific vet about their plan and then have them help you come up with a plan of your own. Because I cannot say that every veterinarian is going to be available 24/7 for emergencies. I will say I think most practices have some plan to help their clients. That may, though, be something like a shared emergency service with other veterinarians in the area. It may be that you need to trailer to the local hospital. Very few people just kind of shut off their phones, but that's not completely unheard of. So when you are setting up with a veterinarian, I think if that's very important to you, it's a reason to choose one service over another, depending on what they offer. But I think really talking with them, making sure you understand their availability, what happens if they're not available and you do have an emergency, and then making sure you have your own plan. So, like Dr. Fugaro already mentioned, making sure you have a way to ship your horse if need be. So, whether that's your own trailer or often there are people in the area that are known to help trailer or have a trailering service for emergency type situations. The other thing I would say is just please be supportive of any creative way that your primary vet is helping to share the load. So, you know, it's hard for us to be on 24/7. I was a solo veterinarian for 10 years, but I had several people in the area that we would help cover for each other, whether that was my maternity leave or going out of town for a vacation or for continuing education and things like that. So it wasn't always me, and my clients have gotten very comfortable with the other veterinarians in the area. But my voicemail always tells them who it is and how to get in touch with them. I try never to leave anyone, um, not knowing who to call. So I think just try to be supportive of that and know that you may not get the exact person that you want, but in order to keep them as your happy, healthy veterinarian, they do also need time off. But yeah, just coming up with a plan ahead of time is the best way to go about that.
Dr. Fugaro, Kate in New Jersey wants to know how horse owners can safely haul horses to an emergency clinic if warranted. What factors should they consider if they need to transport a sick or injured horse?
Well, hopefully you're talking with your veterinarian if you're shipping in, and they can give you suggestions, because it depends on the emergency. If it's a consideration of a fracture, there are very specific ways that we want them loaded on, and how we want them stabilized. In some of those cases, that warrants one of a veterinarian probably to help them with it. In other circumstances, if it's, say, like a colic, and they're going into a facility where they may have surgery, I wouldn't necessarily put hay in front of them, because we really don't want them eating on the way into the OR. Um, the other thing about it is you have to kind of get an idea of how comfortable the horse is, and if the horse is going to remain standing or if they're going to wind up going down in the trailer. Nobody really wants that situation, but I've had some situations where we made the decision to put them in a box trailer where they could actually get up and down, rather than keeping them in, say, a 2-horse trailer and having their head tied up. You do need to think about the length of which you keep your horses tied up in there, especially if they do go down, or if there's a breakaway component. And I think now with the availability and inexpensiveness of cameras, anybody who's doing a trailering can actually be monitoring these horses. I have followed more than one client to an emergency facility when I've left the farm with them, and I've continued to follow the horse and the trailer, just thinking that the horse could potentially go down, and if they needed help at that time. So I think, again, have the conversation with your veterinarian, and I think, to Dr. Cordovano's last statement here, it does also, you do need to be aware that it may not be your veterinarian initially triaging the horse out in the field. And that is a new change in our generation of veterinary medicine. And to try to make a better work-life balance for everybody, we do need, the time off.
Dr. Cordovano, Elaine in Idaho is a facility owner with multiple horses and owners she is responsible for. How can she prepare for emergency situations, taking into consideration so many different individuals?
That is a big responsibility, and it's definitely, part of running a big operation. I think taking the time to speak with owners about their ideal plan if for some reason they can't be reached. We have all of our clients sign in their new client paperwork a statement that says who can make decisions for their horse if they couldn't be reached, and oftentimes that is the barn manager. So having an agreement with your boarders can be helpful, just so everyone's aware that, like, if they can't be reached, you are going to be the one to make that decision. I guess I'm looking at this question from like an individual emergency lens, but I guess also if you were looking at more natural disaster or fire type situations, having a plan just for the barn, like the routes you're going to take or where they're going to go if they need to leave. Really, a lot of this emergency situation comes down to pre-planning and having thought of all the scenarios, or as many scenarios as possible beforehand. But I do, again, just think that it's the barn owners, it's part of the job, right? Your responsibility is to have had these discussions and make sure you understand the goals of your boarders and other people who are at the barn with you.
I just want to echo that as well, because we've recently had a couple of situations of boarding facilities where we have absentee owners, and the owner of the boarding facility is having to make decisions that they don't feel comfortable with. They rely upon the veterinarian, and honestly, it really shouldn't be any of our responsibilities, because we don't know how you value the horse. We don't know your financial resources. We will do that sometimes in Good Samaritan situations, but if you can't be reached as an owner and you haven't provided that authorization for somebody to speak on your behalf, and you haven't told them what you specifically are willing to spend or do or what have you, then it puts us in a very awkward and liable situation. I have an elderly client that travels quite a bit, and she always calls me before she leaves and tells me how much she would spend and what she would do and what she wouldn't do. I probably need to do better at writing it down than trying to remember it each time, but she's at least very, very responsible, and I kind of know what she's willing to do. And recently we had to actually implement that.
Yeah, those are really good points. Thank you both. Dr. Fugaro, Lynn in Oregon wants to know what problems commonly occur during foaling and how to prepare for them.
So if you're trying to figure out what's happening during the foaling, you're already too late. The preparation for foaling has to start months ahead of time. There is a rationale for horses going to facilities where they have people that are trained to help out with foalings. Backyard breeding is certainly a reasonable thing, but you do need to educate yourself and know what to do on these. And we could talk for 3 hours on just foaling emergencies. The key on it with foalings is there are what we call stages of labor, and stage 1 can go on for quite some time, but stage 2 is when the water breaks, and that's when the excitement happens. And with horses, it's a very unique species. That foal has to be on the ground, and my number is about 30 minutes. That foal has to be out. That's very different than humans. It's very different than cows. And if people have not seen a foaling of a horse, it's quite an exciting time for both mare, you, everybody else. It's rather explosive. And in those cases, when they're not going in the direction you wanted to, now you have to change your philosophy on, are we saving the foal or are we saving the mare? And so that's why a lot of this preparation has to happen well ahead of the foaling episode. So There are resources to learning. You should be communicating with your veterinarian. Even in New Jersey, if I'm trying to get 10 miles down the road, it's probably going to take me 40, 45 minutes. If you're calling me and your mare is already in active foaling, that foal better be on the ground by the time I get there. Most likely, we're probably going to lose the foal, and then we're worried about getting the mare out, saving the mare. So I didn't really give specifics about foaling. With foaling, there's a thing called a dystocia, which means they can't actually deliver the foal. But then even after the foal has delivered, there's still a pivotal time for the mare to have other emergencies that can occur. And that can go up to 2 weeks. And there's emergencies that can happen with the foal, which have to be addressed immediately. And I hate to say it, the horse that you don't know that's even pregnant, that foals on you out in the field, and you come out one day in the morning and there's a foal on the ground, they did great. That's wonderful, but it's the horse that you've got all of your preparation, you've put all the resources to it, you've planned ahead of time, and everything goes south on you. And those are the most frustrating ones because you've done everything you can, but sometimes it doesn't always go your way.
Yeah, the bottom line is there's a lot of problems that can occur. And I would second, if you're not comfortable, then send to a facility that is very experienced with foaling out mares.
While we're on the topic of foals, Dr. Fugaro, we have a question from Mosin in our live audience who's curious if there are any differences between life-threatening emergencies in foals versus adult horses.
Any differences? I mean, so unfortunately, like I said, if that foal's not on the ground in that 30 minutes, then they start suffering from hypoxemia, meaning lack of oxygen to the brain. And so that definitely is life-threatening. So we do want to get the foal out as soon as we can. The only ones that I've been successful with at survival, and this is me personally, are the ones that I'm already there before they fold. And when I was actually going through vet school, I volunteered at a foaling farm, and they basically paid me to be there and be ready for when they go and alert everybody so that everybody was there. And everybody was within 2 miles of, the farm. So saving the foal is obviously our first priority, but that changes very quickly. If let's say we're an hour or two down the road and we still can't get the foal out, now our focus turns to, okay, now we just have to get the foal out, and we're going to try to save the mare, because we're probably not going to save the foal in this case. So the next question people say is, well, in humans you do scheduled C-sections, and that sounds lovely. It is very difficult. We've gotten better over the years, but scheduled C-sections, the actual time in which the foal has come out that they're fully developed, and there's a very small window, and I don't think we've really gotten it completely solidified. So routine C-sections are not done as successfully as we see in humans. In the case of C-sections that we do in horses, it's usually an emergent situation, and we're definitely, on borrowed time, and we often expect the foal to be a little bit sick after a C-section.
Dr. Cordovano, Hannah in California wants to know what her options are if her horse sustains a major injury and needs surgery, but she doesn't have the finances to pay for it.
Sure, that's a super stressful situation. That is where Care Credit is a great resource. So Care Credit will approve often in the moment. You can get approved ahead of time, but it can also happen in real time for financing. And not all veterinarians accept Care Credit, but a lot do, and it's something to check with your veterinarian about. So that is a great resource for getting basically a line of credit to be used for something like that. You can also have pre-established insurance coverage, like Dr. Fugaro talked about earlier. And then certainly I would be remiss if I didn't say that there are times when euthanasia is the correct choice for the combination of horse and owner. So, I think most equine veterinarians are very well versed on working on a spectrum of care, and that just means a spectrum of what an owner is willing to do, either financially or just from a time commitment standpoint. And we understand that sometimes the finances or time or capabilities are not there. And if the horse is suffering, then we help you process the choice that euthanasia in that circumstance. But there are definitely options, and really digging into care credit if you feel like you don't have those funds available would be a great option, again, ahead of time, as always, preparing.
Yeah, that's what I was just going to add in, that I think if you're doing it at the time, you're already behind the eight ball with it as well. I'm a big fan of Care Credit, and thank you to them for sponsorship tonight. But that's one option. But again, it's better to have that pre-organized. And the situation of, even though you may have things at your availability, I think having a slush fund is always great to have so that you know. And I think sometimes making a decision a little bit of ahead time, what is my financial stretch that I can do? I mean, look, nobody expects these, nobody plans for them, but we have to. And if you're going to own a horse, you're probably going to have an emergency, and you're probably going to have an unexpected bill. Somehow, if your, water heater goes in your house, you come up with the funds on that. But often, people will have the vet come out, and they have the expectation, or at least historically have had the expectation, that the veterinarian will kind of cover some of these costs and help them float a little bit until they can kind of do, a payment plan. And, I have to admit anymore, and I've been down that road, and I will help as many and any person that really asks me, but we can't be the bank for everybody as veterinarians. So we have equal expenses, and it's not just your horse that we're dealing with. We have plenty of other horses and clients that have the same financial concerns. So it really, a lot of the onus is on the owners to start thinking about this at a time. Have those conversations with your veterinarians, anticipate what kind of numbers you're going to be looking at, and start planning ahead. I mean, people plan ahead for their shows, their farrier. They need to start planning, their trainers. They need to start planning for their veterinarians and these unexpected emergencies.
Really good points. Dr. Fugaro, Colin in North Carolina asked how often emergency plans should be reviewed and updated, and who should be involved in this process.
I'm assuming in this case, emergent plans they're talking about are like disasters. I don't know there's a hard and fast rule of how often you update it. Again, it kind of goes in waves when you have an interest with it. I think if you could do it at least on an every other year basis, that would be wonderful. But it's a matter of what people kind of commit the time. And I think everybody thinks they're committing the time, at least in their head, but you actually physically have to do it. You can think back to when you're in grammar school and, you did the fire drills, and now obviously schools are very different in terms of their preparation that they do, and they practice it and rehearse it. And that plays a role too. And even in a boarding facility, it's not an unreasonable thing to work with your boarders and say, we're going to do a little run through. Now, I don't think anybody finds that overly appealing, especially when they have a Saturday, they want to go ride their horse and spend time. But it is something that we should be thinking about, because the only way you get good at these type of plans is rehearsing them, and it has to be a little bit of muscle memory on there. But I do think routinely looking at, and at a minimum, thinking it through, updating your resources, updating even things people forget about: flashlights, batteries for flashlights, bandage material nearby, things like that. Updating contact information. People have cell phones that change. People have left. People are no longer available for resources. So I think at a minimum that should be done. And you can get your boarders, if you have a boarding facility, you can get your boarders involved with this, and it can be a fun exercise if everybody's committed to doing something like that.
Dr. Cordovano, Pauline from our live audience wants to know how owners can handle wound emergencies where the horse is bleeding significantly.
Yeah, Dr. Fugaro may have other insights onto this as the surgeon on board, but I always tell people pressure is the best way to handle it. So if you can get a bandage on that's thick and you can put a tight wrap, whether that's vet wrap or if all you have is a polo as tight as you possibly can get on, that is the best way to manage it until your veterinarian can get there. Any other thoughts, Dr. Fugaro?
Yeah, I think the one thing that I always try to tell people, so a horse's blood volume, just to give you an idea, is about 10 gallons. So what I think everybody should do at some point is go get a 5-gallon pail. I'm sure everybody has one around. Fill it up with water and dump it on like some concrete where you can stand and see how much 5 gallons look like. Because I think everybody, the first time they see blood, I mean, look, if you're not trained or used to seeing it, it's a bit surprising and it's exciting, and so your adrenaline starts pumping. But the truth of the matter is, most horses, when they're bleeding, they're not bleeding as bad as everybody thinks. Now, some are, I will admit that, but most, you can kind of take a beat, take a breath, kind of make a plan in your head, figure out what you need, calm the horse, calm the people around there. And if the person's not calm in the area, ask them to leave, because you don't need that kind of stressful situation. And just like Dr. Cordovano said, pressure is the key on things. Sometimes ice is helpful, but mostly sounder heads prevail if you just kind of calm everybody down in the situation.
Dr. Fugaro, one of our other live audience members asked if rabies exposure in a vaccinated horse is an emergency.
You know, that's a good question. I mean, I think you should have that conversation. If they're vaccinated, every state's a little bit different with how they handle that. I can speak to New Jersey with it. There are, they're basically going to recommend to revaccinate your horse. But I think the other thing to think about that's a little bit more emergent in these situations is other animals that are around there. Many barns have barn cats. They tend to be overlooked often, especially with their rabies certificates or rabies vaccinations. Dogs on the property, things like that, and there could be exposures that you don't think. And I think the big key with rabies is primarily a fatal disease. And the Department of Health, at least in New Jersey, is the one that kind of oversees rabies exposures. And I would say most of the states, probably that's the same thing. And, they're most concerned about human exposure, mostly because of the high mortality rate. Horses, rabies actually, as a virus itself, is easily killed by plain old soap and water. And it's typically only contaminated in brain and brain materials, whether that be fluid or brain matter with it, or in saliva is the other thing. It's interesting that the virus goes from the brain, follows down certain neurons that go into the salivary glands, which is why the concern in dogs, and specifically cats, and certainly other species as well. That's how it's contracted in a bite that gets basically inoculated with the crush injury of the actual bite and the saliva that gets into that bite. And that's how any animal or person could then be exposed. And just so you know, reservoirs that maintain rabies, and this is throughout the United States and Canada, bats are very common. There's a raccoon population that sees a lot of it. I feel like I'm forgetting something else. Skunk. Skunk are also another one that we see. So I'm not sure that I really answered the question. Is it emergent? I think you should call your veterinarian, and if nothing else, you need to at least find out from your local authorities, whether it's Department of Health or whoever it is, what their requirements are. But it needs to happen in that first 24 hours to get an idea and get a plan together.
I will just add that the vaccine is very effective, though. So a good reason to just make sure that your horse and all animals stay up to date on, if it's a small animal, it's generally 3 years, but annual vaccines for your horse, not to skip.
And that's a really good point, and thanks for saying it, because I actually just had this exact conversation with one of our pharmaceutical reps who said the only reason that we don't have licenses that go for 3 years in horses is the studies have never been done. The vaccine could very well, and I don't know if it is or not, could very well last for 3 years in a horse, but since the research hasn't been done to document it, they're not going to do it. They have done it in small animals, which is why you can either have a 1 year or 3 year vaccine program for rabies in those species.
Dr. Cordovano, George in Tennessee asked how he can consistently fund a veterinary expense savings account. Do you know any creative ways to build it up quickly?
Yeah, this is another great question. And I am a big fan of emergency funds, whether that's for yourself and your household or for your animals. So I'm a big believer in auto funding, so you don't even have to think about it. Most bank accounts will allow you to have a set amount move into a different account that you set up. And if you move $50 a week for 4 months, you will have saved up $1,000. And that will get you pretty far in a lot of emergency settings that don't involve, referral or surgery. But for your typical like eyeball or fever or laceration, like that is going to have you covered. So if you can just be diligent about moving a small amount every week, you know, in just a few months, you'll have a nice little fund that will get you really far. And I think it's the smart thing to do. And really, as a horse owner, it's really the responsible thing to do. I know Dr. Fugaro mentioned it earlier, but it is ultimately your responsibility as the decision to have horses. And we know horses like to hurt themselves. So we are going to do the best we can as veterinarians to get out there and help you, but it is on your end to have a little bit of money saved up. And like I said, that auto funding feature where you don't even kind of notice it's going out of your account is sort of a money psychological trick to help you out.
The other thing is there's a lot more companies now, corporate and small businesses, that are offering funds either for pet insurance, mostly small animal, but I'm sure if you talk to, um, a corporation, they would do it for a horse. I know with our practice, as an incentive we do for our employees, is we give a certain amount every year and they can put it to their small animal bill, another vet bill. They can actually put it to their board, their farrier, whatever they want. So we try to help that and promote the industry. We know people have their pets, they're our family members, sometimes they're their occupation. And I think it's important to be prepared.
Dr. Fugaro, Stephanie in Florida wants to know where common medications and vaccines are made and if their prices could be affected by tariffs.
It's a great question. I have not been seeing, and Dr. Cordovano can jump in as well. I haven't been seeing tariffs impacting. That said, I would say in the past year to year and a half, we've seen dramatic increases in everything. And that was well before the tariffs discussion. One of the things that we have seen that's been a challenge with tariffs is there's been medical devices. I've had trouble getting brands of needles and syringes that I prefer. Doesn't mean I can't get a hold of them. It's just not the ones that I like. And every now and again, we are having. It seems like a lot of our manufacturers have been going through FDA scrutiny, for lack of a better term, and have had to stop manufacturing certain products while they deal with certain regulations and things they have to either update or improve upon. And I mean, that's a good thing, but the challenge is remembering that most of the medications that
All right, I think maybe we lost Dr. Fugaro. So Dr. Cordovano, we're
Yeah,
gonna,
I can fill in there.
yeah, if you
I
don't mind, that'd be
agree.
great. Thank you.
I agree. I think that we certainly, since COVID, have seen drastic increases in pricing. I don't know that tariffs are affecting us yet. I think a lot of our distributors have large, volumes on hand. I do think it will likely we will see something in the coming year, although maybe there's a trade agreement just recently updated, but some of our vaccines are manufactured, at least the primary ingredients are, in research are produced in Europe. And so I can't imagine we're not going to see some changes. We have not seen that yet, but I have seen, just in the last couple of years, I agree. I've seen dramatic increases in a lot of supplies and medication. So I would think it's very likely we will see some changes coming from that.
So Dr. Cordovano, Louise in England owns a larger facility and wants to know how she can train her staff to respond to medical emergencies.
I think the most important thing there is just to make sure that your employees know that you're open to hearing about everything. This really applies to pretty much any business, but having them notice the small things and let you know about it is a good way to ensure that they're going to keep letting you know about it. So tiny changes, it's so much easier to catch things early on. Like a horse that's colicking and rolling is one thing, and sometimes there are no, precursors to that. But a lot of times people will notice like, oh, they didn't eat breakfast, but I didn't say anything because I didn't think it was that big of a deal. If your employees know that you want to hear those tiny things like they only had 2 piles of manure when normally they have 5, I think that is honestly the best way to train people to start noticing that and just really reward and encourage people for letting you know about that. Because we can all see an obvious change or, a completely swollen eyeball. But if someone notices that one eye is slightly swollen when the other one's completely open, like that's when we want to see an eyeball. Like we don't want to see it when it's completely swollen and has been painful for 2 days. So that's my best advice. It is hard though. I think sometimes you can't train that into people. It is just sort of a inherent characteristic that people are observant. So it's usually on my list of things when I'm hiring.
So our last question for tonight, Dr. Cordovano, is from Elizabeth in South Carolina, who wants to know if there are any nonprofit or community resources that could help provide financial support during natural disasters or larger scale equine emergencies.
Definitely. I think that is, again, regionally specific, but the American Association of Equine Practitioners is our kind of governing body. They have an arm, a fundraising arm called the Foundation for the Horse, and they fundraise for natural disasters and equine emergencies, and they also help fund local community or specific veterinarians working in those areas. So I think if you are in an area where there is a natural disaster and you don't know of anyone, reaching out to the foundation would be a great way. I imagine they have a great resource of local coordination efforts. Their email is info@foundationforthehorse.org. And also, if you are feeling generous and want to support, people in other areas, they do take donations, and you can trust that they are funneling it to people who are using it well and actually getting directly to the horses in those areas. So that's my best resource for you, just because I think it really depends on who's in the area. But again, there's going to be state and county depending on where you are.
Just to add in there, I'm back if you didn't realize. Often a lot of corporations, our manufacturing companies, things like that, other veterinary practices in those disasters will often kind of do their own type of plans where they'll try to get resources, and often it's actually getting resources, not necessarily just funds, supplies that are needed, medications, things like that.
Awesome. Well, that's all the time we have for tonight, but thank you both so much for joining me.
Thank you.
Thanks for having us.
And thank you to Care Credit for sponsoring this event. Thank you to our audience for listening and sending in all of these questions. If you're listening to us after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.